woke up, it was Thursday morning, and I had a real bad ringing in the ears. I tried to get up and get to the bathroom and had a real bad, almost like dizzy and confused feeling. I was having a real hard time breathing. I finally decided to call 911, and they came shortly after that. I think they kind of thought right away it could be a stroke. They got me out pretty quick. I was talking when they were in the ambulance trying to decide where to go, and then he said, "We'd be better off going to Mass General." And as soon as they said that, I was like, "Yeah, just go to Mass General."
I had a text message from Bob's girlfriend saying, "Call me ASAP." I called her right away, and at that point all she knew was that Bob had had a stroke and he was in critical condition.
Not too many people realize that up to 20% of all strokes occur in individuals below the age of 45 years. And Robert Zwicker had everything that constitutes a young adult stroke patient. When he came to the emergency department, the initial impressions of the ED, the emergency department team, was that he may or may not have had a stroke or something else. It was really the acute imaging study that showed that he clearly had a clot in the main artery supplying the back of the head called the basilar artery.
The blockage of an artery in the back of the neck is often fatal and almost always leaves patients with permanent, life-changing disability if we're not able to restore blood flow to the brain quickly.
It all happened literally within minutes. We were talking to him, he was alert and able to tell us what happened. And he started deteriorating, and in a span of maybe 2 minutes, he went from talking to being unable to communicate and almost unconscious with severe weakness on one side of his body.
We're talking about a high-pressure, all-hands-on-deck situation where everybody is doing a different job. Radiologists, neurologists, interventionists, emergency physicians, CT technologists, MR technologists. It's an incredible team coming together and making this go or no-go decision.
We gave him an approved drug called intravenous TPA. This is a clot-busting drug that's intended to restore blood flow into the brain. The catheter angiography was performed within maybe 20 to 30 minutes after our intravenous drug was administered.
The devices that are used to treat stroke that reach into the artery and pull out the clot, they're approved for what they do, which is extract blood clots. But no one has yet proven in which patients they are the most effective. What the MGH has done is worked very hard to develop protocols to identify who are the most appropriate patients for this procedure.
Mr. Zwicker was the classic case where it should be done, and it was done competently and effectively.
They took the catheter out the next day, so I was in the ICU for I think 2 days and maybe 4 or 5 days in the hospital. They moved me downstairs.
So MGH is a leader in this area because of the commitment to staffing a 24/7, 365 interventional service. And that's unique in the city of Boston, and in many places in the world, we're one of the few organizations that have made this multidisciplinary commitment.
It requires a lot of infrastructure development. In over 15 years we've accomplished that, and I think patients like Mr. Zwicker are getting advantage of this infrastructure.
I think it's amazing, how serious it was and how quick it came back afterwards. I feel very lucky to be here.
It was an absolute miracle that my brother got the care he did. Really saved his life.
This was such a classic young adult scenario, and I think the outcome is just terrific. He could have returned to work, I think, within a week, and in fact he was discharged within days of what was a near certain bad outcome. We just turned him around.